So, you need to locate the thyroid cartilage first, which is easy to find on everyone. And you're gonna move your fingers superiorly from there, and then underneath of the mandible. I gotta concentrate.
Yeah, you go. Just do it.
Yeah. So body of the hyoid is in the middle, and when you slide your finger about an inch out, up to up, like a lateral and superior, then you are on the greater conus, and then the lesser conu is a bit tricky. You're gonna find the body, right? And try to feel the superior part of the edge 1 centimeter maybe apart, and then you are on the lesser conus on each side. Are you okay?
Yeah, I'm okay.
And then the anterior surface is gonna be easy, like for the manubrium anterior surface, and then the sternum is here, and then the hypoid process is here, right? And the border, among the border, on the top of, in the middle of the two clavicles, there's a suprasternal angle here, right? A suprasternal notch, sorry, or jugular notch. That's the same thing. And here, and then you can feel the clavicular head here, and you're gonna feel the most medial edge of the clavicle. Then you are on the clavicular notch. So it's on one on each side, like here and here. And then from the manubrium, you're gonna slide your finger inferiorly. So then you can find the crest along in the middle. That's the sternal angle of the Lewis. That's the joint between the manubrium and then the body of the sternum, right? And it's gonna be the same level of the rib 2 here. And then what else you need to know? So the infra angle, to find the infrasternal angle, you need to get a consent for sure, right? And sometimes you need to ask your patient to move away their breast tissue. And then from the body of the sternum and inferiorly, and you can feel the infrasternal angle. And then below that, it's gonna be the hypoid process, right? And that's the major one. So you guys need to know from there. That's the one that you would get usually. And for the rib, so it's gonna be easier for you to find the the spinous process of the thoracic spine, and then find the transverse process, and you're gonna palpate around it to the front to palpate the whole rib area. So depending on which rib you got, sometimes it's harder to palpate just because there's a scapula that sits on the top of it, right? So you're gonna just skip the level, and then sometimes you need to have your patient up and then find up, right? So how the rib shape is a bit different, right? It's not like horizontally looking like this. It's slight down, and then when it's the lower level, it's more kind of the downer way. So your finger should go like down and up again when it comes to the front. If you go just to horizontal line, you are not on it, right? You need to try to feel it like diagonal direction and up, high up, like this till the cartilage. And then for the angle, most of the people cannot see. Can you facing that way?